Hello everyone. So this is Dr. Ayush Sharma and welcome to my series Crack NEETPG 2022 in 3 months. All right. So this is my third video in the series, and as you guys can see on your screen, the topic of this video is something that I've been mentioning relentlessly in the past two videos of mine, which is about the revision source that I made from different sources, the three golden notebooks. Now, regarding this resource, this basically encompasses everything that I read in the last 6 months, and I can, without a doubt say that this was the thing that got me my rank, whatever I've got, right? And I've told you the reason for creating a revision source, so that you don't do silly mistakes and so that you can have a very good, strike rate, and you don't forget things, you don't make silly mistakes on your exam day, right? And I've told you one more thing, that your revision source is something that needs to be short. It should be so short that you can revise it within the last 15 days of your exam. I'll tell you one thing. For example, the reason I created this particular revision source of these three notebooks, the main reason for that was, already there were a lot of revision material available, ready-made in the market, like, the prep ladder, rapid revision, for that matter, the DAMS DVT. So many resources were already there. But why did I make my own resource? The reason being, I found that rapid revision itself was very long. It was not something that I could revise in the last 15 days, right? Because the content was enormous for a revision source, right? It contains everything, it is fairly good, it is amazing, but it is not something that I could revise personally. If you can, well and good, it is an excellent resource, but I could not revise it in the last 15 days comfortably, right? So that's why I made an even more concise resource that was, that I could revise in the last 20 days and that I was comfortable with, right? So this is about the revision source that I made. Now, before we step into the video, this video basically contains all the 19 subjects, all the things that I read, and all the things that are there in those three notebooks. All right. So a lot of people keep asking me, "Are important topics? Can I tell me the important topics that I can read now?" A lot of people who have some subjects left, even for that matter. Just yesterday or day before yesterday, I was talking to a lot of my colleagues, and they were asking we have like some subjects, like for example medicine bach raha hai, psychiatry, derma bach raha hai. Should we leave psychiatry and derma? But this is something that you should never do. Never leave a subject and go to the exam, because the reason being, for example, you leave dermatology. See, dermatology is a very specific subject, and very specific targeted questions come in the exam. Okay, you'll be surprised how targeted questions are asked, right? In dermatology at least. So when something can be read, completed in 3 hours, why do you want to leave that subject, right? There will be a little bit difficult questions, but they are going to be 1 and 2 in number. You cannot just leave one subject and let go of the easy questions, easy scoring questions, right? So that is going to cost you your rank even. So don't do that. Don't leave any subject. If you have any subject left, please take my advice and go for this particular resource. If you have never read that subject also, even then this resource will be useful. Which resource? This one, Prep Ladder Rapid Revision. I can strongly vouch for it because it contains everything. There's nothing more that you need to know for a subject, right? So it will be like your first reading, but very fast, right? So if you've not read a subject even once, go for Prep Ladder Rapid Revision. If you have completed your first reading, welcome to the video. We'll get on with the content that you can use to make your revision source, your very own revision source that you can keep revising in the last 2 months and get a bloody good rank. All right, so let's start with the video. Before we start, okay, I'll list out 2 common sources. Okay, without this, I don't think if you don't have these, I don't think this video will be useful for you, because most of the content that I have in my notebooks is from these 2 resources. Now, don't be disheartened if you're not a DAMS user. This DAMS must know topics, this particular course, okay, in itself is a short course. It is available for just 1,500 rupees. Okay, it is available for just 1,500 rupees. Just 1,500. Okay, right. So this is something that you can easily take here. I mean, it's not a very big amount, you know. So just for 1,500 you can get this particular resource of DAMS must know topics. Second resource is the DAMS NEET TND, INICT TND, whatever for that matter, any TND I would say, because I have used DAMS personally, so that is the main resource that I am going to talk about. If you're not a DAMS user also, you can take your own TND. Prep Ladder has its own TND. Marrow, I think, has revision videos, right? So what TND basically does is that it is a great revision source, because It has 75 questions that encompass the entire subject. Everything that is important is going to be covered in those 75 questions, right? It's very, very high yielding. If you don't have DAMS TND, you can go for any other TND that you have. And if you don't have anything, I would strongly suggest you to take up this course. The reason being, it is extremely high yielding. And one more important thing is that a TND will keep you in track. इन ट्रैक इन द सेंस यू विल हैव अ टारगेट कि एक हफ्ते में एक सब्जेक्ट करना है, एक हफ्ते में दूसरे हफ्ते में एक सब्जेक्ट करना है, 3 दिन में एक सब्जेक्ट करना है, राइट? सो यू विल हैव स्पेसिफिक नंबर ऑफ टारगेट, स्पेसिफिक नंबर ऑफ डेज फॉर ईच सब्जेक्ट, एंड दैट विल बेसिकली कीप यू ऑन ट्रैक in your preparation, right? So a TND, I always say it is a very good resource to back your preparation even at this point, right? All right, now let us start with the first subject, which is anatomy. Now anatomy has already been extensively covered in the first video. If you've not watched it, I'll just link it down in the description or maybe during this video itself, right? So please do watch that. It has a much more detailed explanation. But regardless, just for the sake of completion of this video, I'll start with anatomy. So anatomy ke andar I told you that the parts that we're going to study, the basic components, the places from where the questions are asked, are the upper limb, the lower limb, the pelvis perineum, and the head and neck, right? So upper limb, I already told you that the main resource for upper limb was the DBMCI YouTube video, integrated upper limb session. It was by the orthopedics faculty along with the anatomy faculty, and that is more than enough to cover the entire upper limb. It is, I think, 1 hour 15 minutes long, and that is all you need, okay, for the upper limb at least. For lower limb, what I did was, see, I told you there also that anatomy was the only subject that I did not do from DAMS. I did it from prep ladder, okay? So lower limb, go for your notes, prep ladder, DAMS, or anything. Make a short summary of it. I already discussed in that video how to go about discussing a particular thing like upper limb or lower limb. You have to go from the nerve supply. You have to know the compartments properly. You'll have to know the nerve injuries, which particular fracture is associated with which particular nerve injury, and what are the tests for that particular nerve, right? So that is how you need to go about things, okay? Then comes pelvis perineum. Again, the same thing. Make a summary, 5 to 10 pages of your main notes, okay? Summarize that in a very short and sweet way so that you can remember. And the most important thing here in pelvis perineum is bladder injuries, okay? Bladder injuries. All right. Apart from that, in the thoracic cavity, you have the azygous vein that you need to know, and of course you have the inguinal canal in the lower part of the abdomen, okay? So these are the things that you have to know in the upper limb, lower limb, pelvis perineum part. Then in head and neck, again I've discussed this at length in my first video. Parasympathetic ganglia, right? For this, again, there is this video on I'll just link it down. I don't remember exactly. I'll link it in the description or maybe during this video itself, by Ashwini sir, again the DBMCA faculty of anatomy, amazing teacher. So he has discussed the parasympathetic ganglia and the head and neck portion. I'll link the exact time jahan par ye discussion ho raha tha. I'll specify the timestamp as well, so you can go there. You can just write down this part from that video, right? Then the functional components of neurons, again, functional components of the cranial nerves, right? Again, that is something that is present in the same video by Ashwini sir. Okay, pharyngeal arches, again Ashwini sir, but this is a different video, I think, on embryology. Go ahead and watch it, right? Muscles of mastication, again, I think Ashwini sir has made a video on this also, muscles of mastication and the cadaveric image, the dissection image in the head and neck video. I'll link everything down in the description, don't worry, okay? So muscles of mastication, something that you have to know, the cadaveric image at the level of the neck, the deep cervical fascia and everything, right? And apart from that, this is plus minus. If you know this, well and good. Otherwise, it's not very commonly asked. You'll need to know 3 arteries: the subclavian artery, the internal external carotid artery, and the axillary artery. The branches, the part supplying, and the whole deal. The reason being, it is important surgically as well, right? Surgically as well, and the facial artery and maxillary artery. Maxillary artery, again, very important. I forgot to write that. Okay, maxillary artery, very, very important, right? So these are some things that you have to know in anatomy, nothing else. Okay, so everything that is here is all you need to know, nothing more. Now coming to the second subject, physiology. Physiology, see, I already told you this. Without must know topics, please don't watch the video further. Please get that. It is an excellent resource. I guarantee you personally that you won't think that even a minute of your life has been wasted. Amazing, excellent resource. They have covered the entire subject in a period of 1 to 1.5 hours. It's very good, and it is only 1,500 rupees, and that is something that is very cheap and can boost your preparation drastically. Okay, so physiology, again, the main resource is the must know topics, right? Apart from that, in the must know topics, of course, you cannot cover the entire subject, right, in 1.5 hours. So there are some subjects, some topics of physiology, or every subject for that matter, that are not extensively present, right? For example, CNS part, Now this pen is seriously okay. CNS part, the kidney part, the CVS part, and the nerve muscle in the general physiology. Okay, so these are some parts that you need to add some more details. Kidney is not at all covered there, so please read kidney a little bit more in details. CNS, CVS, and nerve muscle physiology. This is covered, but you'll have to read it a little bit more extensively, I feel. Okay, and general physio. General physio के अंदर क्या? The osmotic thing, simple diffusion, the facilitated diffusion, that thing. Okay, and the total body water questions. Okay, that is all you need to know. That heavy water, D2O, T2, all the markers and everything, the elements that you use for a particular component, ECF, ICF. So that is what is important for physio. All right, so physio is done. Coming to the next subject of biochemistry. Now this biochemistry, now this is something that is not very well covered in the must know topics. It is slightly, I think, a poorer source for biochemistry, because biochemistry, to cover biochemistry itself, it takes a long time, right? It cannot be completely covered in 1.5 hours, because there are so many metabolic disorders there, right? So first of all, the video on must know topics is short, but it gives you an idea how to approach things, right? Ma'am has just discussed, I think, two or three metabolic disorders. She just said, this is how you need to study, right? So please do that. You'll get an idea of how to study things, how to go about things, right? So must know topics, again, very small. I don't think it'll be very useful for this particular subject, but it will give you an idea of how to approach biochemistry as a subject, right? So must know topics, the number one source. Okay, then we have the second thing. The second thing is a summary of all cycles. I'll tell you how I did this basically. Let me just share my biochemistry notes with you. So here they are. So can you see this? What do I have here? In this one page, right? In this one page, front and back, I have all the cycles of carbohydrates, including the glycolysis, the gluconeogenesis, the glycogenolysis, everything. Now, you don't have to read the entire cycle. I've told this numerous times, right? You just need to know the basics of the cycle and how, you see, actually these three cycles are somewhat linked, right? There are some enzymes which are ऊपर नीचे थोड़े से, right? Which are like slightly different. For example, what is glycolysis? Glycolysis is breakdown of glucose. Okay, and what is gluconeogenesis? Gluconeogenesis is formation of glucose from a non-glucose source like amino acids. So there are some steps. Gluconeogenesis is basically glycolysis reverse, but the irreversible steps, for that there'll be some substitutes, right? So there are irreversible steps of glycolysis which are substituted by certain steps. So you need to know what steps are substituted, what are those enzymes, and what is the redetermining enzyme. That is it. For example, I'll give you an example also here. So I've started here. So look at this. Gluconeogenesis, glycogenolysis. Okay, the end product in both is going to be glucose, right? Because gluconeogenesis is formation of glucose from other sources other than carbohydrates. Glycogenolysis, breakdown of glycogen to form glucose. End product is glucose in both. Okay, and there is one common step. So this is how you approach a cycle. You find out the common steps, you find out the different steps, and you're done, right? So the common step is from glucose 6-phosphate to glucose formation, which is done by glucose 6-phosphatase enzyme. This enzyme is important because there is a very important disease associated with glucose 6-phosphatase deficiency, which is known as von Gerke's disease. So this is how you approach things. Are you understanding? Are you getting what I'm saying? Right? You read the enzymes, right? The enzyme which is linked to a disease particularly, right? And what are the different enzymes of different cycles which are linked together. So that is how you read things. Are you understanding, getting the gist of it, right? So this is how I have made this cycle. So this is it. I mean, this is the gist of things, right? है ना? So I've done the clinical features as well. I mean, this is much more detailed in my main biochemistry must know topics notes, but this is just an idea. I have told you कि मैंने दो pages में, one page in back, front and back, I have summarized all the glucose related cycles, right? There is gluconeogenesis here. कि if alanine is the source, then what will be the process, and what are the other sources like, lactate, oxaloacetic acid, glycerol, all these things, right? And all the intermediates of Krebs cycle. These are all these anaplerotic reaction things. Okay, everything is here, right? And this is my start of biochemistry. So this particular thing was given in the must know topics, right? So this particular question was given. So basically she wanted to say, ma'am wanted to say कि the way they ask a question is a clinical vignette form. It is a metabolic disorder. That is how biochemistry is being asked. They don't ask core biochemistry things now, right? So for example, this 2-year-old child, history of vomiting, lethargy, restlessness, aversion to protein containing foods. Now this itself tells me the diagnosis is some kind of a urea cycle disorder, because there is aversion to protein containing foods, right? Then there is mental retardation present. Investigation, blood ammonia is raised. Okay, so that rules out certain things. The lower part of the urea cycle disorder is ruled out because their ammonia levels are not raised, right? So that is how you need to approach this particular question. Okay, so ammonia is raised, orotic acid is present. Now this confirms the diagnosis: ammonia raised, orotic acid present, OTC deficiency, right? So that is how we need to approach, right? तो अभी मैंने एक example question दिया है यहाँ पर, उसके बाद आप discuss nuclear cycle in detail, ठीक है? So I've written read cycle from notes. So I have my notes. Whenever I read biochemistry, my main notes are on the standby. I just open my notes, go through the cycle very quickly in 2 minutes. Then I read whatever is given here. I read the basics and then I go towards the deficiency disorders. Bus. So like this, I've summarized all the things. This is just urea cycle. I have proteins, I have amino acids, I have carbohydrates and everything, right? So that is how we need to approach this particular subject of biochemistry. All right. Now let us move on and discuss the rest of the subjects. All right, so like I told you, the source is must know topics. Apart from that, summary of all the cycles. I've discussed how to compile the summaries along with the metabolic disorders associated with those substances. Genetics. Now genetics is something that I feel takes a lot of time, and questions कितने आते हैं? एक दो. So if you just know the basics of genetics, like translation and क्या बोलते हैं, basically everything, all the DNA things, in terms of क्या बोलते हैं, your protein synthesis, your translation and all these things, if you know that, which direction it occurs in, 5 dash to 3 dash or 3 dash to 5 dash, right? So all those things, if you know, that is more than sufficient at a basic level, right? If you want to go into it, definitely you will crack one or two more questions. But I feel it is a very vast topic and something that needs to be dived at in the starting phase of your preparation. Okay, if you're going for INICT, then that is definitely a different thing, because PGI loves to ask genetics, right? So then you definitely have to go read genetics if you're preparing for INICT. But NEETPG is not very fond of asking genetics. Even if they do, the questions are relatively simpler. If you know the basic things, you'll be able to answer them, right? All right, now coming to the basics of biochemistry. Now this is something that is available on Prep Ladder. Prep Ladder के अंदर Smiley ma'am, amazing teacher again for biochemistry. She has two videos. I think the first and the second video, it talks about some tricks and hacks to biochemistry. It is very high yielding. It talks about fasting state. It talks about insulin, glycogen, and all these enzymes. Basically, what happens in fasted state, what happens in diabetes, the energy source. Very important things for the RBC, for the blood, for the RBC, for the brain, for the liver, everything. So it covers the basic things that you can use as a common sense resource to answer biochemistry questions, right? And of course, then we have the rate determining step and the enzymes. All right. Okay, sir. Now let us talk about pathology. Now pathology again, sir. Pathology, I always say that must know topics is an excellent resource. Okay, I've told this to everybody that I know. Whenever they ask me how to read pathology, must know topics is excellent for this. It covers entire pathology almost in a very concise, crisp manner. It goes in an approach based manner. Everything is there, everything that you need to know, right? Apart from that, if you can top it up with DAMS TND, great, perfect, amazing, right? Then you can go with, if you want to read a little bit more. See, this is something that is not very well covered in must know topics. This is the only topic of transfusion reactions. So transfusion reactions you can add on from your main notes into the revision source that you have. Okay, transfusion reactions, and of course general pathology. Okay, so this is about patho. Coming to pharmacology, you see, pharma is a very vast topic, first of all, and that is why everybody is slightly afraid of this particular subject and even to revise it. So I would suggest, there is this amazing teacher in DAMS. His name is Thiru sir. Whenever you attend his TND, his TND is not about 75 questions. He covers the entire pharmacology in a period of 6 to 8 hours, right? Please, I would suggest visit his TND. Very high yielding. Must know topics in TND again. Nothing else you need to do. Whenever you want to read pharma, just open up your notes that you have made from the must know topics and the TND section. It will take 2 or 3 hours and you'll be done with it for revision. Okay, that is all I've done for pharma. Okay, coming to forensic medicine being a short subject, you don't have to do a lot of effort there. Okay, and I've discussed this particular teacher also. She's one of my best top amazing educator, Zainab ma'am, right? So Zainab ma'am, I told you, she teaches all the 19 subjects, even though she's a radiologist. She's an inspiration to me personally, and she has covered, of course, FMT and toxic also. There are two videos, one for forensic, one for toxicology, each 1 hour long. So just watch those videos. You'll be done with FMT and toxico. Apart from that, top it up with must know topics. There is no third thing that you need to do here. Bus. Just Zainab ma'am's two videos and must know topics. That is all. Okay, coming to the next subject of microbiology. Okay, I'm going to cover this a little bit faster because I think I'm taking a lot of time, right? So next subject is microbiology. Now microbiology may the most common mistake that people do is running after systemic bacteriology. It is not that important. Trust me, it is not that important. It is important, but it is not worth spending so much time on. It is very important, but it's not worth spending so much time on, in the sense that it's a very large ocean to go into, but there is, in fact, there is no end to it, right? So the more you read, the more you'll feel like, ये नहीं आता, वो नहीं आता. So don't dive into that ocean blindly, right? उससे questions आते हैं, significant number में आते हैं, but don't waste a lot of your time there. Rather, you need to focus on the things that I've highlighted here: fungus, parasites, and viruses, right? Focus there. Very, very short, very, very crisp. In fact, if you are a damn student, you must be knowing how Surya sir teaches these topics. Amazing teacher again. Very short. His fungus is very short, very high yielding. Parasito, again, he summarizes, if you've attended his lecture, he talks about this table that he makes of 10 columns, and he puts the parasites in them, and in fact in one big chart you can complete entire parasitology. So again, an excellent educator, excellent videos, please watch them. Mycology, parasitology, virology, any source that you use, please focus on these three topics over your systemic bacteriology. Systemic bacteriology mein what you need to do is you need to make a list of culture medias. Okay, make a list of culture medias, of diagnostic tests, of characteristic feature of different bacteria, and of the life cycles in parasito. Okay, I'll tell you later that parasito की जो life cycles है ना, for this particular thing I would suggest you read them once, but in the last 10 days definitely revise them, and for that we have Preeti ma'am on an academy. Okay, in the last 10 days every year she takes 5 or 2 lectures in the last 2 days, in fact, about all the parasites, the life cycle, so that you don't make mistakes. Life cycle is something that you need to read during the end because you keep forgetting those things, right? So that is about microbiology. Apart from that, the sources I told you, yes, the main notes and the must know topics for microbiology. All right, so this is about microbiology. Moving on to the next subject, ENT. ENT is a short subject. Okay, so I'll give you two options. You can either read it from your notes, the entire notes. That is what I did, because in my third year I read ENT so many times from my notes, मैं चाट चुका था notes. Even if you tell me today मुझे थर्ड ईयर का यूनिवर्सिटी का पेपर देना, ENT का यूनिवर्सिटी पेपर, नॉट नीट पीजी, यूनिवर्सिटी पेपर where you have to write 10 marks, लंबे answers, I'll still be able to give it, and I'll still be able to pass with distinction, at least in my college. I don't know how other colleges are evaluated, right? Because of the fact that I've read it so many times, I can complete entire ENT main notes and all the questions in a period of 6 to 8 hours maximum, right? If I have to go read in details, right? Other than that, if I just have to read my notes, it'll take me hardly 3 to 4 hours, right? So you can either go with your main notes, right? Either you can go with your main notes, or you can of course use the same thing, must know topics with TMD, right? So that is about ENT. Now let us talk about ophthalmology. Ophthalmology के अंदर again must know topics plus TMD and must know topics. So must know topics, ophthalmology, amazing. It is 1.5 hour long, but sir Saurabh Sharma, amazing teacher for ophthalmology. He has covered all the previous year questions and the important topics in a period of 1.5 hours. So the content is so much, I'm not kidding, it is 1.5 hour long, but it will feel like a lot of content if you try to write that down. He's speaking very fast in that video, and he's covering so much in 1.5 hours. It is mind boggling, in fact, right? Top it up with TND and you're done for ophthalmology. A PSM. Now PSM is one subject that I've hated for uh, my entire MBBS curriculum. I've hated it during NEET PG, and in fact I did not read it properly. I've not done one proper reading of this subject. I hated it so much, okay, because I found it very, very boring. So what I did in the end, again, a revision source, right? So there are two videos on YouTube on the doc tutorials channel, okay, on the doc tutorials channel, which you can definitely watch. Sorry for this, right? Yes, so two videos on YouTube of the doc tutorials channel by Rajshri ma'am, okay. So she has two videos, one for INICT, one for NEET PG. You can definitely watch both of those videos. There are some topics that are covered here and there, so watch both of those videos, take things, note them down, and you're done. Okay, what I honestly did was I took screenshots of the YouTube video, okay, and I used to revise from those screenshots. Screenshot laptop पे सबको लेना आता है ना, so open the video on laptop, take screenshots of each slide and revise that from there. That is how I did it. Okay, gynae and obs. Now gynae and obs, if you ask me, is the most important subject for NEET PG. Most important subject, single most. Very high number of questions are asked in the exam, and it is very highly scoring. And in fact, a lot of people tend to make mistakes also there, because so many things are protocol based, right? You don't remember the exact protocol. For example, Bartholin cyst, right? Things keep changing again and again. For that, you need to be updated. How do you stay updated? TND. Okay, I know about DAMS TND. Very great source to be updated, and even to cover the subject for that matter, right? So for this, must know topics, excellent resource. Okay, there are some things that are not covered. I've listed them down here. The cancers mainly are not covered. CA cervix, endometrium, ovary, and a little bit of, I think, molar pregnancy bhi covered hai. So yeah, just the cancers are not covered. So cover them separately from your main notes. Top it up with TND बस उसके अलावा कुछ भी नहीं करना gynae ops, right? DAMS is excellent for gynae ops, no issues about that. Coming to medicine, same thing again, same thing. Must know topics plus TND. But medicine में एक problem क्या आती है? If you just go directly for the must know topics, medicine is something that requires revision, especially the cardio part, right? So if you're stuck anywhere in the must know topics, open your notes, refer to that, then again go to the must know topics, right? What I'm trying to say is, when you read your revisions for medicine, it should not be like you're reading some data. It should be like you're flowing in the case. Basically, when you're reading rheumatic heart disease, you know कि अच्छा ठीक है, school going children 5 to 15 years, ठीक है, all the Jones criteria, all the 7 Jones criteria, 4 minor criteria, everything should be flowing into your brain like that, right? If it is not, then please refer to your main notes. Okay, if you have any kind of a conceptual problem, and your murmurs, your क्या बोलते हैं, splitting of heart sounds, that should be on your tips, right? So please refer your main notes for that, and then go for must know topics, right? Conceptual things from the notes. For revision, must know topics, TND, and you're done. ठीक है, ओके. सर्जरी के अंदर मस्ट नो टॉपिक्स, excellent resource, nothing else you need to do. Just the JIT part is slightly lacking there. JIT part you can read from main notes. And one more thing is, this particular thing, I don't know if it is necessary per se, but it is extremely high yielding, and it is extremely a valuable source for just a revision. I mean, some days, when you don't feel like studying, just open up one of Zainab ma'am's special classes on surgery, right? And I'm telling you, you won't be disappointed. Okay, so she covers everything with radiological integration, and that is how things are asked, right? Again, an excellent source, right? Coming to pediatrics again, TND plus must know topics. I don't want to elaborate on this, right? Anesthesia, you see, anesthesia again a short subject, right? तो इसमें TND में ना most of the things are covered. तुम सिर्फ TND कर लोगे तो भी बहुत है. Top it up with must know just to get the updates of CPR, right? If you don't have the latest ATLS protocol, go for your not ATLS, I mean your क्या बोलते हैं, एडवांस कार्डियक लाइफ सपोर्ट, ठीक है, राइट? तो ACLS and BLS, right? If you don't have the latest guidelines of, I think, 2021 only it got updated. So if you don't have that, please refer to must know topics. And of course, TMD is more than sufficient for this. Radiology, you see, it's about images, right? So Sumer sir, if you have attended DAMS, Sumer sir has this image book. Go through the image book, just the image book. Don't go through the theory part. It's not necessary. Okay? Then you can go through must know topics, and of course the TND paper, bus, right? And other than that, there are some image sessions that again Zainab ma'am conducts. Again, Zainab ma'am, you can watch any video anytime that you want. When you don't feel like studying, just open up one of her videos. It'll be like magic. It'll be like flow. Everything will keep flowing, and you'll not be wasting your time. At least you'll be studying things, right? You'll be knowing things. All right. Second last subject, dermatology. Again, see, dermatology is something that is very specific, right? It is slightly bigger, but the things that are asked are very focused and very specific, right? So you can go through must know topics. Saurabh Jindal sir has very beautifully compiled everything in must know topics. There are some things that he'll say, I think alopecia part and leprosy part, which is better covered in DBT. So along with must know topics, this is the only subject for which I'm suggesting DBT to you, right? Go through that. Then we have syphilis and leprosy, the two topics that you have to do from the main notes, right? The last two subjects, orthopedics. See, I tell you, orthopedics के अंदर there are multiple short videos that Tushar sir has made, Apur sir has made, and Abbas sir has made. Go through any of those. Excellent sources for revision. Apart from that, must know topics, again Tushar Mehta sir, 1 hour, I think 1 hour 15 minutes. That is all you need to do. TNT to top it. That is it. Psychiatry again, see, psychiatry के अंदर I will tell you, even more than main psychiatry, core psychiatry, what is the most important thing in psychiatry is psychopharmacotherapy, and of course the diagnostic part. We don't make mistakes in the diagnostic part usually, right? Where we make mistakes is the pharmacotherapy part. So psychopharmacotherapy should be on your tips. I guarantee you personally कि every exam has at least 4 questions on some psychopharma drugs. Should be on your tips, right? Other than that, TND, INICT or NEETPG. INICT is something that I would prefer. I think you should do both because INICT focuses more on INICT, and INICT has a very high number of questions from psychiatry due to the NIMHANS component. Other than that, you can go for NEETPG TND and plus minus must know topics. Or, of course, it is a short subject. Go read your entire main notes. That is again a very beautiful option. So that is it. I've summarized all the 19 subjects of my 3 golden notebooks, and this is all that I've read in the last 6 months of my preparation. I hope this was helpful. And if you want me to cover anything else in detail, if you want me to cover any other topic for that matter, please type down in the chat box and I'll make sure I look at it. Fine. All right. So I hope this was useful, and that is all from my side. If you like the video, please like, share, subscribe, or whatever. I don't know how to say this. So yeah. So that is it. Right. So thank you so much. I'll be seeing you next time. Until then, goodbye, good night, and take care.